So now we would like to invite our clients to reflect on the findings. Essentially, they are reflecting on these three questions. So what was the biggest reveal for them? And of that, what is they feel is going to be the most impact for their organization from this project? And we will also like them to talk about what is the next step moving forward, how they're going to use this information and continue to make a data-driven decision making. So we will like first Eric from Barnapper Center to reflect on these questions. Eric?
Hello, thank you for having me. I would be remiss if I didn't start by thanking the team. You guys did an excellent job. The faculty, the students were amazing to work with throughout this project. So I'll start with the first question. The big reveal from my perspective as a good MBA, my mind immediately goes to the financial impact of our work. So I was astounded just by the amount. I think it was $45.6 million over the course of 7 years. And that's astounding based on our organizational size and our constraints of geography and financial resources. As an organization, we feel that the big reveal from this project legitimized our sentiment that everyone deserves access to quality preventive care, that no matter what, their symptoms shouldn't get severe enough that they feel like they have to use an emergency department as a primary care source. And so we were able to do that through our effective treatment of chronic disease. Number two, the impact of this project for our organization is the opportunity to employ a research-informed approach to interventions related to ED overutilization. Naturally, I think any of our nonprofit leaders can relate to this. We have a limited size in our leadership team. We pride ourselves on how busy we are and how hard we work. And we do internal reflections and quality analysis, but there's no way we could have undertaken such a massive project. So again, thank you for this. Number three, the next steps of this approach would include a review of our intake process. And all of these are really to serve our clients best. We always relate back to our mission. To employ a tool like the Elixhauser score to identify patients with the highest need. And if you'll remember, the reason we went with that scoring tool is because it had a more diverse diagnosis captured in it, as well as the behavioral health component. A lot of our clients suffer from behavioral health disorders or substance abuse. And that really links to the community assessment that was created by Baptist Health. So we try to rely strongly on our partnerships. We want to create custom education courses that target the most common reasons for ED visits within the county, evaluate our office hours, and revisit our relationship with the hospital discharge team to ensure continuity of care.
Right. Thanks, Eric. Glad that we are able to. Bill, I would like now to invite Bill to reflect from Family Community Services point of view. Bill?
Thank you. I too appreciate so much the collaboration, the work, the efforts of everyone involved. It's been a pleasure over the past weeks and months to work with you all. You know, my wicked problem, as I love you to express, has been really not just a scheduling problem, but really ways to keep us afloat in this unique little component of our counseling program, so that we can serve the community, we can serve victims of abuse and neglect, substance abuse, etc. And so these tools will have an impact. These suggestions, these hardcore specific suggestions will have an impact on better ways for us to increase revenue and keep our doors open to do that, because it really depends on our ability to schedule well, bill efficiently, to keep full-time staff available to serve the community. So the next steps are to implement many of your suggestions, really, and find ways to use some of the tools that you've suggested we take advantage of, and to improve the documentation that's being done by all of the staff in this department. And I can't thank you enough for those ideas and for giving us new tools to try to improve the way we do business.
Thanks, Bill. So next, Leah, I would like to invite Leah to reflect.
Hello, everybody. I'm Leah Nash with the League of Women Voters of Florida. Again, just like William and Eric, I want to say thank you. Karthik and Dan and Joyner and Payal and Thomas were all amazing to work with. And it was just wonderful getting to know them throughout the weeks that we talked about this project. But one of the big themes that we talked about when we were meeting a lot is assumptions and how people make assumptions, and maybe our members make assumptions about why people are voting and why they're not. So the data is so important to us. And there was so much data for this team to go through and just create the files that they did. So that was a big, giant part of it. A big reveal from my perspective, I think, is we work so hard on registering voters that we kind of forget to look at those numbers of disengagement. And those were presented to us here. And I think we need to start thinking about that a little bit more and focusing on them as well. The impact of the project. We also talked a lot about storytelling in our meetings. And I think that now that we know this data and they're not assumptions, we can start talking to people in a targeted way and encouraging them to be impactful with their vote and also to be knowledgeable in their voter education. So thank you for that. That's a lot of guidance. And next steps, what I would really love to do, when we talked about this a lot in our meetings, is we have 29 local leagues made up of volunteer members. And I'd love to put together, I want to talk and look at more of the results and put together the geographic areas that we might not have thought would go together and put them together and say, okay, maybe this group of people aren't voting and they're all kind of alike, the demographic wise. Think about why they're not voting and then put those areas together so they can create resources, and the league as a state league can help create those resources for them based on the data. So again, thank you for this amazing work, so much work, and you are making a difference. So thank you very much.
Thank you very much, Leah. So would want to again say a huge thanks to all of our community partners providing this real world project. And for those who are listening in, it is while it is not easy to come up with a proposal and come up with a project that will fit nice with the 12-week and make impact for them and make meaningful ways that students can also work. And our community partners, clients, they're also meeting with our interns over this 12 weeks, every other week. So they are investing they are not only providing the problems and opportunities, they are investing a lot of time and effort also onto this project. So again, this success is reason, they are a fundamental reason to. So again, we really appreciate them making time and working with us, and we look forward to working